When people hear the word hormones, they often think about one thing: mood swings, menopause, maybe testosterone. But hormones are doing much more than that. In reality, hormones are part of the body's communication system. They help coordinate how different systems in the body work together: energy, sleep, mood, metabolism, and focus. All of these are influenced by hormones. In simple terms, hormones are chemical messengers. They're released by glands in the body and travel through the bloodstream, sending signals to tissues and organs. One way to think about hormones is like a text message between different parts of the body. The brain sends a message, a gland responds, another organ adjusts to what it's doing. That constant communication helps keep things running smoothly day to day. When that signaling is balanced, most people simply feel normal. Energy is steady, mood is stable, sleep tends to work the way it should. But when those signals fall out of balance, the effects can show up in a lot of different ways. Hormones don't operate in isolation. They interact with multiple systems at once. For example, hormones involved in metabolism also influence energy levels. Hormones involved in sleep can affect mood and focus. Stress hormones can influence weight, sleep quality, and mental clarity. This is why symptoms connected to hormones often don't show up just in one place. Some people might notice lower energy, changes in sleep, brain fog, or shifts in mood. They may also notice changes in body composition. None of these symptoms automatically mean that there's a hormone issue, but they can sometimes reflect changes in how the body's signaling systems are functioning. And that's where context becomes important. This is a conversation we have with patients fairly often. Someone has symptoms that they feel very real to them, but they've been told their labs are normal, and that can be kind of confusing. The important thing to understand is that many hormone lab ranges are based on population averages. They show what is statistically common across large groups of people, but that doesn't always reflect what feels functional for a specific individual. In our clinic, we look at hormones through a system pattern: symptoms, lab values, medical history, and how someone responds over time. Labs are important tools, but they're only part of the picture. When hormone therapy is considered, the goal isn't to push levels as high as possible. The goal is balance, supporting how the body functions day to day. That process tends to be gradual and individualized. In our clinic, we focus on bringing levels back to a proper balance, monitoring symptoms and labs over time, making adjustments based on response. Hormones also don't exist outside the bigger picture of health. Sleep, nutrition, movement, stress, all of these influence how hormones behave in the body. So part of the responsible care is supporting those functions as well. Not without rigid protocols, but with sustainable habits that help therapy work the way it's intended. Hormones are often discussed in very simplified ways online, but in reality, they're part of a complex system that changes over time. That's why thoughtful care tends to focus on patterns rather than quick fixes. If you've been feeling off and haven't found clear answers yet, this is a conversation worth having with a qualified clinician. And if you'd like to learn more about how hormone health is evaluated, we share more educational resources here at Elite Health. If you'd like to learn more about how we approach hormone health or speak with our team about a possible evaluation, you can contact us through the Elite Health website.